Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Waris. Welcome you all in Healthcare with Dr. Waris. Today's topic which I have chosen for you is AIDS and HIV positive cases. HIV is a human immunodeficiency virus. When it persists for more than 9 months to 12 years, this condition can lead to AIDS, because HIV infection is a virus and AIDS is a condition which followed by the long stay of HIV. HIV positive cases and AIDS are the two different conditions. Means you cannot say that when one person is HIV positive then he must have AIDS, because there are 3 stages of HIV, 1 and 2 and 3. When it becomes in stage 3, and then it is called AIDS. AIDS means acquired immunodeficiency syndrome, when our immune system become collapse or destroyed by the virus that we call HIV, and then so many diseases can develop also, but this virus can lead to AIDS when it is in stage 3. The incubation period of HIV virus is 1 to 4 weeks. Means that virus can enter in our body and sign and symptoms appear. Flu-like signs and symptoms initially occurs in this HIV positive within 1 to 4 weeks of infection. When it persists, it leads to AIDS. And AIDS incubation period is 9 months to 12 years, and as an average we can say that from 9 months to 12 years period is required to develop AIDS, because AIDS is a condition which is followed by the HIV. When AIDS occurs, then it collapses our immune system, so many opportunistic infections can develop, likewise pneumonia, tuberculosis and cancer also, and Kaposi's sarcoma on skin, diarrhea and dwindling fatigue, malaise, unexplained weight loss and shortness of breath, white patches on tongue and oral candidiasis, etc. These symptoms occurs when AIDS develops. Source of spread of HIV is sexual conditions, which when infected lady and or homosexual or heterosexual, and the blood transfusion, not a screened blood transfusion. Pregnant lady with AIDS can or HIV positive give birth to her baby also positive, and so these are the sources. And barbers which uses their instrument for shaving and hair cutting salons, and these can spread this, and dentists which are unhygienical or not been autoclaved or washed properly, the dentists also spread this disease. So if we can check these or spreading sources, then we can control this and the spread of HIV. So how we can say that AIDS, now it is AIDS. AIDS when the stage 3 occurs of the HIV virus, so it is called AIDS. When the CD4 level, one of the kind of WBC, would falls from its normal range, which is normal range is 500 to 1200, but when it declines to 200, it's called the AIDS. So we have to maintain our level for these CD4 levels up to 500, from 500 to 1200, and this could be because when we use regularly and antiretroviral drugs, which one or two tablets, one or two drugs are combined in one pill tablet. When one is positive with HIV, and when one is positive with HIV, he has to take drugs 3 months to 6 months to become undetectable on the slides or on tests, and the viral load can decline. But these antiretroviral drugs can be taken for lifelong to maintain their position. If the CD4 level becomes decreased below this level of, then it's AIDS, and the life expectancy of these AIDS patient is not more than 5 to 7 years. So it's all about our AIDS. If you have any question regarding AIDS, please write in comment box, and take care. Allah Hafiz.